Hello, everyone. My name is Taka Penn, and I'm a nurse practitioner student here at Auburn University. Today, I'm going to be talking about osteoporosis. Osteoporosis is a condition where bone strength weakens and is susceptible to fractures. It's very common. There is no known cure for it. It often requires lab tests or imaging to diagnose. It's common for ages 50 and older. It's more common in females. If you have a family history, more than likely you would develop osteoporosis. In severe cases, urgent medical attention is recommended. And the first sign or symptom of osteoporosis is a bone fracture. Now I want to talk about the risk factors. Diet. A lifelong lack of calcium and vitamin D plays a role in the development of osteoporosis. The purpose of the calcium and the vitamin D, the calcium helps build bone and the vitamin D aids in maintaining bone strength and health. Eating disorders. It's severely restricting food intake and being underweight weakens bones in both men and women, lowering the calcium intake. Exercise. When you have an inactive lifestyle, you increase your risk for osteoporosis. Family history, people whose parents have osteoporosis are at a higher risk of developing the disease. Smoking cigarettes and drinking alcohol excessively can increase your risk for osteoporosis. Medications, long-term oral or injected corticosteroids, such as prednisone and cortisone, and anti-seizure and cancer medications are all associated with osteoporosis. You have hormone and autoimmune disorders. If you have a chronic disease or condition, ask your doctor about how it might affect your bone health. Ethnicity, people who are Caucasian or of Asian have the greatest risk. Questions a provider may ask. Your health provider may ask, what type of foods and drinks do you consume daily? How often do you exercise? Do you use tobacco or illicit drugs? Do you drink alcohol? Has anyone in your family ever been diagnosed with osteoporosis? Have you entered menopause? Top examinations. You have your bone mineral density test, also called the dual energy X-ray absorptiometry, DEXA. It's a DEXA test. The test is designed to let the patient know how strong and how dense the bones are in particular areas. This test is the test that used to confirm osteoporosis. Then you have your fracture risk assessment tool. When used, helps to predict the likelihood of developing fractures. Repeated testing allows the doctor to compare the results over the periods to see if you're losing bone or maintaining it. You have your biochemical marker, test of the blood and or urine, and it may help to estimate how fast a person is losing or making bone. Nuclear bone scans, CT scans or MRIs can show changes that may be caused by cancer, bone lesions, or inflammation, or new broken bones, or any other conditions. This is the T-score. I just wanted to show you guys what they use to identify if you have osteoporosis, and the T-score is derived from the DEXA and the average adult bone density after reaching complete bone mass, and that's and we meet complete bone mass at 25 years of age. Overview of the best treatments is the bisphosphonates. This medication helps to prevent the bone loss. It may be taken orally or by injection. You have your hormone therapy, which is raloxifene. It helps to increase the bone density. You have another hormone therapy, denosumab, helps to prevent bone loss, and it's administered through injections every 6 months. And then you have testosterone. And this hormone therapy helps to increase the bone density in men. And you have your supplements, vitamin D and calcium supplements. Teaching strategies. What would be taught is for the patient to eat more calcium and vitamin D rich foods. Vitamin D helps with better absorption of bones. Exercise to get stronger bones. Do weight bearing exercises such as squats, burpees, push-ups, and aerobics. And get bone density tests more regularly. This will help to know the risk beforehand. Thank you, everyone, for listening about my osteoporosis. If you have any questions, you can email me or call me. Thank you.